Hello, everyone. Welcome to this presentation. I'm Sylvia Chen, Senior Director of Consulting and Education at eHome Center for Geriatric Care. Whether your organization runs long-term care homes, retirement communities, or home services, I trust that human resource programs are top of mind. Today, I'm going to share a holistic solution for operators in the senior care sector. That is, as the title says, employer-sponsored virtual training backed by human resource strategy. In general, the Canadian senior care sector is faced with shortages of all types of frontline workers, but the condition is especially concerning with personal support workers. While the solution here can be applied to other senior care professions, is derived from our experience with PSW training and employment. And thus, I will focus on PSWs as our example today. So let's first take a quick look at the pressing PSW shortage issue and why the existing initiatives that make headlines recently are not going to solve the problem. Then I will explain why employer-sponsored virtual training backed by human resource strategy is going to be a promising solution and deep dive into its execution pathway. Since PSW shortage and related human resource challenges faced by the senior care sector require solutions from multiple fronts, we will explore other methods that could help broaden the labor pool as well. Challenges in hiring and retaining PSWs and other healthcare frontline workforce are not news in the senior care sector. However, the recent unfavorable spotlights on long-term care homes in the COVID pandemic, together with the emerging regulation mandates, further exacerbate the conditions for operators. Three trends are fueling the absolute demand increase and the relative difficulties in hiring and retention. First of all, the demand for senior care from the population is at an all-time high and still keeps increasing due to the aging demographics that expect a quality life in their older age. People older than 65 years will account for about a quarter of the Canadian population in 10 years. And the difference between the life expectancy and healthy life expectancy is about 9 years, which implies that in the last decade of people's lives, they would need various levels of personal and medical assistance. The second driver is the requirement from regulatory bodies. The current target of raising daily care time per resident in long-term care homes to 4 hours by 2025 implies huge additional demand for PSWs. At the same time, the COVID-19 pandemic necessitated some regulations that affected staffing, like the single employer policy and the enhanced IPAC practices. They both pose de facto constraints on casual and even part-time employment, which was universal in the pre-pandemic era. Last but not least, the increased competition for talent in the broader healthcare industry worsens the labor market conditions faced by some organizations. From the senior care sector's perspective, there are strong external competitors. Hospitals always sit at the top of the pay hierarchy, and home services and other community-based care providers are gaining traction. These non-senior care sector entities compete for PSW supply. Within the senior care sector, the war for talent is also heating up as new licensees open up new long-term care homes and the ever-increasing demand from long-term care beds cannibalize the PSW supply of retirement homes. In response to the dire situation and imminent progress, government bodies invested to reward working PSWs and encourage people to get PSW training. These efforts made headlines and to an extent can boost short-term PSW supply. However, they do not provide a sustainable solution. Temporary wage increases aside, why would even large-scale free PSW training solve the problem in the long run? Let's look at the underlying issues with these bandage solutions. With the latest information from public colleges, the current free PSW training programs contain no return of service clause and no penalty for quitting the training at any stage. Candidly, there's no incentive or binding force to guide trainees into the senior care sector after their graduation, if they even do graduate. In fact, since these programs require 3 months of non-paid full-time commitment, they are very challenging for the prospective PSWs, who are usually financially constrained and working multiple casual jobs. There are anecdotal stories about stay-at-home moms, lawyers with sick parents applying for these free programs, which is all good for seniors they care for. But these people, they are unlikely to become long-term PSWs serving in the senior care sector. Even with all the optimism, let's say these 8,000 trainees all graduate and work as PSWs, we understand that the systemic shortages cannot be addressed with one batch of supply. And let's not forget about the existing pay grade hierarchy between hospitals and the senior care sector, which will keep draining PSWs from the ladder. So the condition is challenging, and the current solutions will likely only function as temporary bandages. What should we do? What can we do? Here, I would like to share a holistic solution for operators in the long-term care sector. Employer-sponsored virtual training, backed by innovative human resource strategies, will provide a promising long-term solution to PSW shortage. First of all, let's look at the chart here, which summarizes how the senior care sector gets PSWs. We start from the left upper corner, the whole workforce pool. Some of them become PSW trainees in the left lower corner. After graduation, they enter this three-layered funnel. At the top layer, some of the PSW graduates enter the senior care sector. Then some quit due to concerns around the job security of this lower skilled occupation. Then even more quit since the workload and lifestyle are not sustainable for many PSWs. Only a small fraction will remain in the senior care sector after this training process, and they make the stable quality PSW team, the backbone of quality senior care in organizations. Employer-sponsored virtual training backed by innovative human resource strategies is a three-pronged solution that addresses pain points along the PSW career pathway. Number one, it creates predictability. Employer sponsorship targets an audience with high potential to serve in the senior care sector. Those who have applied for such openings and those who are doing non-PSW jobs with the employers. Binding employment contracts secure both employers and employees. Number two, the solution reduces costs for both employers and employees. Virtual delivery offers flexible access and broad coverage at a lower cost. Not only is the employer's investment more cost-effective, but the PSW trainees bear little financial risk and minimal interruption to their work and life. Number three, the solution helps to rebuild the employment relationship. Training is not only part of the solution and only delivers the maximum efficacy with changes in human resource strategy, including redesigning staffing model and responsibility allocations, refreshing corporate culture, and fostering a long-lasting connection between employer and employees. The higher predictability, lower cost, and stronger employment relationship will attract people into the PSW path and stay long-term in the senior care sector. Based on the above analysis, we can see that such a holistic strategy helps senior care sector employers to solve labor shortages. Furthermore, it helps to improve quality of care in a cost-effective way. The direct outcome of such a solution is that senior care operators can build and maintain a stable, quality frontline workforce with reasonable cost and promising long-term return. First of all, the lower turnover will save hiring and training costs for employers. Additionally, with a well-structured staffing model and properly designed workload, employers will save costs from fewer payments for off-time and agency hires. Finally, fewer labor relations and scheduling chaos will save related administrative costs. On top of the direct outcome, employer-sponsored virtual training backed by HR strategy also establishes a solid foundation for continuous care quality improvement, which in turn will improve operational outcomes for the organization. The indirect benefits come in the following forms. First of all, a stable workforce can provide higher quality of service as skills and experience are retained. It's not hard to imagine the chaos in a home with ever-changing frontline workers. Secondly, a corporate culture of fostering long-lasting employer-employee and caregiver-client connections will enhance quality of care and client satisfaction. Finally, better quality outcomes will attract new clients and save costs related to problem remediation, which should resonate with everyone who has ever handled resident complaints and underfilled beds. Now that we understand the solution, how it works, why it works, let's move on to its execution pathway. For senior care operators to execute and benefit from the three-pronged solution, overhauling training and recruitment is not enough. The overall HR strategy must also evolve. The human resource architecture of senior care organizations is represented as the house to the left-hand side of the slide. We'll look at it from the bottom up. First comes the foundation. All the human resources strategies and practices are built on individual organizations' vision, corporate culture, corporate structure, policies, and procedures. On top of the foundation are HR strategies, which regulate responsibilities of employees, staffing model, and provide guiding principles for recruitment, compensation, and benefits. The underlying strategies decide the upper layer, which is the day-to-day HR management activities, recruitment, training, and retention. The whole structure exists to support the overarching human resource goal, the healthy talent circulation and growth. The three-pronged solution touches the foundation, the recruitment and retention practices, but it actually focuses on the training and HR strategies. Changes in training are straightforward. In a nutshell, training has to be integrated into recruitment and retention. Training as a recruiting tool refers to using binding return of service contracts to attract and lock in prospective employees. Training as an incentive, on the other hand, encourages current non-PSW employees to upskill and commit to long-term employment. The systemic review and overhaul of HR strategies entail more profound changes. The points here are by no means exhaustive, but list out some key actions that will enable and sustain the benefits of the three-pronged solution. First, modify work allocation and process to improve efficiency. Senior care is a regulated field, and operators need to upgrade job descriptions, develop and refine policies and procedures so as to ensure that all changes comply with regulations. Second, redesign the staffing model. To maintain smooth operations, senior care organizations need a proper combination of full-time, part-time, casual, and maybe agency employment. Third, adapt recruiting efforts to widen the candidate pool and streamline the employment process. With the changing candidate demographics and hiring channels, efforts have to be invested in targeting the proper audience, expediting training and onboarding. Fourth, revisit compensation and benefit design to meet employees' needs and concerns. The demographics of prospective PSWs have changed and complicated by the dynamic social economic environment. Compensations and benefit design has to reflect these changes. For individual organizations in the senior care sector, the execution of this three-pronged solution is complicated and not necessarily risk-free. eHome Center for Geriatric Care is pushing the envelope in solution development and execution, and we are here to support our peers. eHome operates 805 long-term care beds in GTA and serves 16,000 seniors annually with its community service arm. As a quality leader, eHome pledges its deep expertise to offer consulting and training services through its Consulting and Education division. A PSW certificate program is provided via eHome Training and Learning Center, a registered private career college. Other programs can be offered and tailored to employers' needs, including the RSA and home helpers training. eHome is currently helping multiple long-term care licensees to set up and operate their new homes through consulting engagements. The services range from strategy to operational advisories, and field support can be available upon request. In the future, eHome looks forward to supporting even more senior care operators from strategy, operations, and training perspectives. The success of individual organizations have always been a focus, but we also have to recognize that the frontline workforce shortages are long-term systemic challenges for the whole sector and require collective efforts to leverage all the possible resources. The Canadian senior care sector should work together to explore other options to secure a stable frontline workforce pool that can deliver quality care. United, coherent voices are extremely important when it comes to policies and lobbying. For example, we should lobby for government funding that reimburses employer-sponsored training. Non-broader public sector entities are entitled to government training funding for employers. For example, the Canada-Ontario job grants that reimburse up to $15,000 per employee. The broader public sector employers, such as long-term care homes, should be included in this kind of government support. Also, the whole sector should demand consistent policies that aim for long-term development and continuous improvement of senior care. In areas where the domestic labor supply cannot keep up, we also need policies that support the inclusion of the international workforce. To sum up, solidarity and cooperation among senior care sector stakeholders, especially operators, is critical for initiating, enabling, and achieving the much-needed systemic changes. With that, I will conclude my presentation. Your comments and input would be most appreciated. Please feel free to reach out through the contact information on the slide. Thank you for your time.